670 AM, 96.3 FM, The Source.
All right, a couple of minutes before 12 o'clock. I am so glad you're in the room, Robin.
Yeah.
Dr. Alyssa Dweck is on the phone, MD, OBGYN in New York. She is going to speak about what she specializes in, female sexual health and medical sex therapy. She's written a book called The Sexual Spark, 20 Essential Exercises to Reignite the Passion. And there's something she wants to make sure we hear about, and we're going to tell you more about it. Vyleesi, and we're going to spell that in a second. It's a prescription medication used to treat hypoactive sexual desire disorder. And without saying anything else, let's say good morning to Dr. Dweck. Good morning, Doctor. Thank you for being on the show with us today.
Good morning. Thanks for having me.
Oh, you're welcome. I mentioned I'm glad Robin is in the room, and I'm not kidding. It's not an easy topic, right? For you, it might be.
Well, it's an easy topic for me, so I'm glad we're speaking about it today.
Well, you know, the problem is earlier I talked about guitars, and after the interview I wanted to go play one so bad. So I'm just wondering if that same thing is going to happen here. So what is hypoactive sexual desire disorder? That's probably the first question I have.
Sure. So look, most women will have some transient drops in their desire at different stages of their life. Perhaps they have an argument with their spouse or they're having stress at work. But HSDD is a whole other entity. It's really a medical condition. It stands for hypoactive sexual desire disorder. And actually, it's more common than you might think. Approximately 1 in 10 premenopausal women will suffer with HSDD. And this is a complete lack of desire where you didn't have it in the past, and marked distress as a result of this lack of desire. This HSDD interferes with women's self-esteem, with their body image. It interferes with their intimate relationships, and it really can be quite notable.
So what happens emotionally if her husband is saying, "Hey, come on, baby, let's do something"? I mean, does she get angry with him or something? What happens?
Well, some women avoid intimacy. Other women just go through it as a chore. But after all, there is treatment for this condition, and I think that's the most important thing. So when we talk about low desire, we also have to talk about high distress. So women who are distressed by this issue can seek treatment, which can really alleviate things.
Is this issue common on women who have not had menopause, or is it mainly for women after menopause?
Well, I'm specifically here to speak about HSDD, which affects the 1 in 10 premenopausal population, because there's a lot of other nuances that come into play in the menopausal population. But I wanted to really bring up that so many women don't bring this up to their doctors because they feel embarrassed or uneasy or like they're alone with their concerns. By the same token, some healthcare providers don't necessarily address this situation during the routine exam, and I think that that's something that's now on the forefront of conversation.
Yeah, I mean, I can imagine if it's a little uncomfortable for a radio host to talk about sex. Can you imagine telling your doctor, "What is wrong with me? I don't have a desire"? That's got to be a real hard thing to admit.
Well, it might be hard for some people, but I'm hoping that gynecologists and other healthcare providers can actually put lots of women at ease by having this conversation. I typically address it every time I have a well-woman visit with somebody and normalize the conversation. This HSDD has actually been in the medical conversation for decades, and since 2015, there's actually FDA treatment for this disorder now, so it's more a topic of conversation. I'm thrilled to be working with AMAG Pharmaceuticals to discuss the first and only as-needed FDA-approved HSDD treatment called Vyleesi, bremelanotide injection, which is a melanocortin receptor agonist and works in the brain to help with acquired generalized hypoactive sexual desire disorder. As with all medications, there are some common side effects. They include nausea, flushing, injection site reactions, headache, vomiting, and Vyleesi is contraindicated in women with uncontrolled hypertension and known cardiovascular disease. But the unique thing is that Vyleesi is an as-needed medication. It's used in anticipation of sexual intimacy rather than as an everyday medication. So this is quite novel.
Let me just slip in the station ID. This is WOCA Ocala, since we're at the top of the hour. I wanted to ask you, is this... do you have any stories of women who've taken this and what changes they went through? What did they experience?
I do have stories, yes. Anecdotally, this diagnosis of HSDD can be delayed because it doesn't come to a healthcare provider's attention until a couple of months or years have gone by of women suffering with their symptoms. But for the right person who qualifies with HSDD, this treatment can really be quite marked and notable and really establish higher self-esteem and enhance the relationship in general because women are feeling better.
And so you had referred to it as an injection because you referenced the phrase the injection site, so it is not a pill.
Yes, I was hoping you was going to ask that. So this is not a tablet. This is a self-administered injection. An auto-injector is used. It's quite easy to use. In fact, there's a video where you can view its use on the website Vyleesi.com. It is a non-threatening type of administration that women can use as needed, and it's typically given in the lower abdomen or in the upper thigh. Essentially painless and quite easy to administer.
Well, you also talk about when you inject this, there might be a temporary increase in blood pressure?
Yes, it's quite transient and typically resolves on its own within 12 hours. And so typically not a problem, but this is why we don't recommend it for people with uncontrolled hypertension.
And so before a patient is prescribed Vyleesi, then that patient should let their doctor know all of the medications they're taking.
Absolutely. And you would imagine that somebody with this condition is either having a face-to-face with their healthcare provider or seeking the advice of a telemedicine physician. I think there's plenty of information that will answer these questions on the website Vyleesi.com. That's VYLEESI.com. And there's also information regarding the questionnaire that would help people to know whether they might qualify for HSDD and its available treatment.
So would the book help, let's say the husband is listening and said, this sounds like my wife. How does that's an awkward conversation too, right? Would the book help him with that conversation?
You said it. Well, I think intimacy and communication are intricately tied together. So a woman who's suffering with HSDD, I hope, is discussing this with their partner so that they can approach this jointly.
Very good. All right. I want to make sure we give out the websites. Could you just repeat the websites again, please?
Of course. It's Vyleesi.com. That's VYLEESI.com.
Okay, very good. And your book is The Sexual Spark, and I did find it on Amazon. Dr. Alyssa Dweck, thank you so much for being on the show with us today.
You're welcome. Thank you.
All right. We will be right back.
And destroyed by the press. We begin there in 1 minute.
This